Hi and welcome to the upper limb assessment. So we've gone through and collected all the information about the history of the presenting complaint and the medical history of the patient. So the next one is to work out how are we going to decide if there's an injury to the upper limb, what extent of the injury is it? So I tend to work through this little anagram. So position, bulk, abnormal movements, tone, myotones, dermatones, reflexes, coordination, proprioception. So let's just really briefly break them down. This just might give you a scaffolding or a template to build your viva from. So position. Say out loud to the examiner the position of the patient. Are they slumped forward? Maybe they've got a back injury as well we haven't picked up. Are they leaning to the other side, trying to lean away or relieve the pain? The bulk. Look at the bulk of the muscles on the patient, front and back. If they've started to have wasting of a particular muscle group, we need to pick that up because that's going to give us an indicator to potentially what the injury is. Abnormal movements. Abnormal movements sometimes can be caused by diseases such as Parkinson's disease and tremors, and we should have potentially picked that up already in our history taking. But it might be something to do with part of the assessment and the diagnosis we're looking for. So get the patient to place their hands down onto their thighs and just watch the skin and movement of the arms for any tremors or fasciculations. The next one is tone. Tone is the body's ability to resist gravity. And one of the easiest way to check tone in the upper limbs is take the patient's arm into your hand and get them to relax it and just say, I'm going to take my hand away in a moment and I want you to keep your arm up. If they're able to keep their arm elevated and not collapse their arm, they've got good tone. Remember to check left to right, so symmetry. Myotones is the next one. So when we test myotones, we're looking at motor. Think motor. It's the group of muscles that is innervated by a singular spinal nerve root. So what we're talking about is C2, C3, C4, all the way down to T1 for the upper limbs. And what I'll do now is really fast go through the different myotones. So the patient bends the neck forward, this is C2, and extension is C1. Just remember, we need to test the power to do with the motor. So when the patient bends their head forward, place your hand in the back of their head and get them to push up against your hand. When they do that, count to 5, 1, 2, 3, 4, 5, and release. And we're going to give that a score, a grading from 0 to 5. 0 being paralysed and 5 normal power. Just remember to check up on those scales. So C2, C3, C1, C2, C3, lateral, C3. Remember to do it left to right. C4, shrug the shoulders and the examiner has the hands on the shoulders. C5, raise the arms up, pushing down on arms bilaterally. C6, pick up sticks, flexion, wrist extension. C7, flexion of the wrist and extension of the elbows. C8, thumbs up, making sure that the patient's thumbs don't collapse under pressure. And T1, hand abduction. So making sure that the patient can hold their fingers apart and that you're not going to be able to collapse them back in. Followed by a deduction together and not opening the fingers, that they still have that power grip within their fingers. Then there's testing of the dermatones. The dermatones is the surface of the skin that a nerve root innervates. So it's similar to a myotone, but we're testing the sensitivity of the skin and how well those nerves are functioning. Have a look on the website for a dermatone chart. It's a lot easier to almost verbatim learn that chart, and then it's just going through testing or touching each one of those dermatones and asking the patient, can they feel it? The 3 types of sensitivity or pain that we need to perceive is temperature, hot and cold. We don't often have access to ice or a heat pack during this exam, but we need to know that's part of it. Sharp pain, so pinprick, and light touch, so a cotton bud. And going through each of those dermatones, can you feel, taking the pin out, can you feel. That will get us an idea about the dermatones. Then we move on to reflexes. There's 3 points that we need to test reflexing in the upper limb. So the elbow or the funny bone, in the middle of the arm, the corner of the wrist. If we test these 3 reflexes, and just have a look again on the website for more specific definitions, we're just looking at the contraction of a group of muscles. When we strike the tendon, we're seeing, is that innervating the pathway, which gives us an idea to potentially where the problem is. Coordination is, can the body's group of muscles work together in order to achieve a task? So simple ways to do it in the exam, the patient to touch their nose, and then making sure they also increase the speed as they touch their nose. The other one is touch the nose to the examiner's finger. And finally, for the upper limbs, making sure the pronator and supinator muscles are working. So coordinating the hands by turning the palm and the back of the hand alternating in the hand. Proprioception is the last one, and it's to do with the body's ability to locate the limb. So we get the patient to close their eyes, hand out straight, and you lift the limb up. And you ask, is the finger up or down? Is the finger up or down? By this we can gauge what's normal, what's abnormal, and take all the information together to create a potential diagnosis.